is so hard to find? I'm on this job portal, that job portal. I'm searching and searching and nothing is coming up. If that is how you're feeling about finding healthcare remote jobs, then stay tuned. I have something for you. There are two ways to get your foot in the door for a healthcare remote job. Number one, network. A lot of times it really depends on who you know. Start going to networking events or just talk to people you already know in the healthcare industry. Ask them what type of entry-level positions they currently have available. Then look at the qualifications for that job to see if you have any of those qualifications. If you don't have all of the qualifications, then ask yourself if these skills can be easily obtained and start working towards gaining those skills. Which leads me to option number 2, certifications or education. You'd be surprised at how many certifications you can easily gain within the healthcare field, or even associate's degrees that you can earn in those 2 years. Some of the certifications may even only require you to complete education within a matter of months. I'm talking like 3 months, 4 months. There's things like, for example, you have healthcare IT. Some of those IT certifications only require 3 to 4 months to complete. There's also medical billing and coding, healthcare registration, surgical tech, radiologic tech, etc. The list goes on and on and on. Just start doing some research to see which one you're more, you would lean more towards, which one you're more interested in. Now let me go back to number 1 for a bit and share a bit of my story in hopes that it'll inspire you to keep pursuing your dreams. I had no healthcare experience whatsoever when I first got started. However, because I had a reputation for being a fast learner, a go-getter, and very resourceful, one of my cousins, she hooked me up, y'all. She connected me with her manager, and I just played up my research, writing, and analytical skills to land me that payment posting job. So I started out at the bottom and worked my way up to a team leader / trainer. So in the healthcare field, healthcare revenue cycle management, it's one big cycle. So stay tuned. In the future, I'll be sharing a video on the full healthcare revenue cycle management, how the cycle actually works. I want you all to have that full understanding of how that cycle works. So getting back to my story, I came from a retail background for so many years, straight out of high school. My first job was working at a grocery store. And then I started working in other retail stores as a cashier or a sales associate. And so for many, many years working as retail, I wanted something different. I wanted something that had the potential to be more of a career. So I needed a change. I had a lot of other life things going on. So my cousin was like, okay, how about you move out here to Dallas? Because I moved from Louisiana to Dallas. And my first job in Dallas, I was working at Target. I got a job as a cashier at Target. And I was like, this is just not it. I went to work every day because I knew I still needed to, I needed a job. I needed money. So I did what I needed to do. But my cousin was like, okay, I talked to my manager about you because over the years, I know you personally. I know what you're capable of doing. You have strong work ethics. You learn very quick. I've always been that way. even on every retail job I had been on, I was able to excel pretty quickly. Raises, promotions, whatever. I was even the last retail job that I had, I was on track to becoming a director. But I wanted something else. I wanted to get out of that retail field. So then I got with I did the interview with her manager. He was the AR manager. But again, he was over the AR department. He was over payment posting, credit balance. All of those fall aligned with healthcare RCM. So because I didn't have any experience, he was willing to give me a chance because of, number one, I had likability. Number two, I had that work ethic. Number three, I had integrity. Those are the three things that's another tip that can help you play up your other skills that may actually be transferable into something else. So because of that, he was willing to give me a chance, and I started at the bottom with payment posting. However, in payment posting, I didn't post actual payments at first. I posted more of the denials. So these were insurance claims that were denied, and I had to actually post whatever those denial reasons were into the system, the practice management system. I got very good at posting those denials, understanding those EOBs, which stands for explanation of benefits. I got very good at just the basics. In a matter of 6 months, I moved from payment posting to then AR. So then AR is a whole nother beast. That's where the money, you're bringing in money with AR. So then I began to master that. And so I started to continuously learn other parts of the revenue cycle. And so that's how I was able to move about throughout the healthcare revenue cycle management industry. Now, if you find any of these tips very helpful, go ahead and like, share, and comment. Let me know what you think. Till next time, bye-bye.